An alarming new study out of the CDC shows childhood vaccination rates, we're talking overall childhood vaccines, have dropped for a second year in a row.
So Dr. Melanie Ribbeck, a pediatrician with Kelsey-Seybold Clinic, is here to explain why health officials are concerned about this. Good morning.
Good morning.
All right, so where are we at with these childhood vaccination rates, and how troublesome is this situation?
So the data that was released yesterday by the CDC was for the 2020 to 2021 school year, and it showed the overall vaccine rate at 93%. So that's down 1 percentage point from the year before, which is a trend that started at the start of the COVID pandemic.
All right, let's break down the different things and why a child would get a vaccine in the first place, and then you're concerned about it. Let's start with polio, measles, and diphtheria. Are we low on those, and what is your concern about that?
Yeah, overall, those rates are pretty similar across those three illnesses. And the concern is that, especially where you have pockets of even higher numbers of unvaccinated children, that is where we can see outbreaks of those diseases that are otherwise preventable by the vaccine. Most recently, there was a measles outbreak in Columbus, Ohio, that's actually still ongoing. And so we're very concerned about children that are not vaccinated being susceptible to getting sick from those illnesses.
And what about tetanus shots and chickenpox vaccines? What are the rates with those as well?
Yeah, so tetanus is most commonly given with diphtheria and pertussis. That's commonly called the DTaP or the Tdap vaccine. Varicella is given at the same time as the measles vaccine. So you get those shots when you're 1 and when you're 4. And those rates are also similar. The CDC rates, sometimes it's hard to break it down by state because each state has a little bit of different requirements. But overall, the rates are pretty similar, somewhere in the low 90s for all of those vaccines.
And then how did COVID vaccines, I guess, relate to those? Much lower?
Yeah, absolutely. Only about 30% of the country has gotten their booster dose for COVID, and those rates are even lower in children.
And there are some exceptions for some of these childhood vaccines. Is that what some of these parents are using to justify not vaccinating their children?
Yeah, the parental choice exception, that rate is actually pretty steady. It's about 2.5%. So definitely not the majority of children that are unvaccinated are from those exceptions that the parents requested.
Do you have any indicators at all of why these vaccination rates might be dropping?
We definitely think that it was related to the pandemic because that was when we started to see the trend of vaccine rates going down. Between children being in remote learning, not being physically present in school, and between doctors' offices having, some offices were closed, some offices were on limited hours. At the start of the pandemic, we just haven't seen a full recovery back to normal, even though so much other things have gone back to normal now.
And what do you want to say to parents who may be concerned about vaccines? What kind of conversations should they be having with their pediatricians?
I absolutely think that they should be talking to their pediatrician. This is a trusted healthcare professional that can give you the best guidance about your specific concerns. I talk to parents all the time who are worried about side effects or worried about the risk for illnesses that have been disproven to be linked to vaccines. And so those conversations are so important for us to have in the office to address those concerns and go over what are the benefits of vaccines. And then on the same side, there are some risks, but in general, those are very low. Vaccines are very safe, and that's what we always want to communicate to parents.
All right. Thank you, Dr. Melanie Ribbeck with Kelsey-Seybold Clinic, for that message. Appreciate you.